Hey, Bride is Sam. Can you hear me? Debbie's going out right now. Okay, copy that. Thank you.
Building. So it was easy for me to get out. I knew like if we wanted to go underground, I know how to walk through parking garages.
I'd like to call the meeting to order. Madam Secretary, please call the roll.
Director Kim? Director Ryder?
Writer is here.
Chair Harrington?
Present.
You have a quorum.
The next regular meeting of the Audit and Compliance Committee will be held on Friday, April 17th, 2026 at 9 a.m. I don't see any directors, so we don't need a motion for that. Madam Secretary, is there anyone registered to provide in-person or virtual oral testimony or submitted written testimony to be included in the record?
We did not receive any registrations nor any written testimony.
Hearing none, we'll go to item number 3.
Yeah, I'm checking the audience. I think we're good.
Are you sure?
Yeah.
Okay. Looks clear to me. Okay. We'll now have a report from Chief Corporate Compliance and Privacy Officer, Nicole Lamiro. She'll review and report on 2 action items: County Care Compliance Program, Fiscal Year 2025 Annual Report, and the Cook County Health Provider Compliance Program, FY 2025 Annual Report.
Thank you. Good morning, Directors. Nicole Amiro, Chief Compliance and Privacy Officer. Today we have highlights from fiscal year 2025 to share, metrics for the comparison of 24 to 25. We have contacts by category, both for the System Compliance Program as well as County Care Compliance Program, and recoveries on the County Care side. Also have provided annual reports for both Cook County Health on the provider side and County Care. And then lastly, we'll look at our compliance work plan for fiscal year 2026.
Thank you. Can I have a motion to receive and file the FY 2025 annual reports for the County Care Compliance Program and the Cook County Health Compliance Program?
So moved.
Motion has been moved and properly second. All those in favor, say aye.
Aye.
Any opposed? Motion carries. The ayes have it.
And then I think Nicole's going to finish the rest of her informational report. Oh, sorry. I could have added that part to the notes. I apologize. I'll do that next time.
Okay, so Nicole will now give an informational report.
Okay, thank you. All right, looking at the year-over-year contacts, we are at 2108 this in fiscal year 2025, and that is up from 1905. And we're seeing the largest increase on the County Care side. We believe because of the increased activities of HFS, OIG, and law enforcement, and we'll talk a little bit more about that in a minute. Next slide, please. All right, this is on the system side, so the hospital side. We are at 971, which is slightly down from fiscal year 24 when we had 1172, largely due to our office is no longer reviewing all contracts prior to execution. So on the contract bucket, you'll see it's 121, whereas previously it was 431.
I have a question.
Yes.
What types of contracts have been eliminated, just in terms of nature?
We used to review all contracts, all supply chain contracts, and now we are reviewing only those with issues on the compliance and privacy piece. Makes
sense. Thank you.
Yep, you're welcome. I do want to note that the first 3 categories, privacy, regulatory, and contracts, are 75% of the work that we do in our office.
Are the privacy breaches? What happens there?
Anything that's HIPAA related. So a request for information, it could be a request to modify records, it could be, and also breaches as well.
Yeah, in the future, could you break out the nature of those?
Sure.
Regarding privacy, I think it'd be helpful for us to know.
Sure will. Okay. If there are no other questions, I'll move to the next slide. Is the County Care slide. We're at 1137, was a large increase. We were at 733 last year, and as we mentioned, we believe this is due to increased activities from HFS, OIG, and law enforcement, because the fraud, waste, and abuse bucket has gone from 5 up to 516, whereas last year it was 240. We also had 3 designated staff on the County Care side, so we do have more issues because of that as well.
Yeah, and I think also with the fraud, waste, and abuse, it'd be helpful to have a breakdown by category, so we have some idea of what that consists of, and what the amount is too, because it is a significant percent of what we're seeing.
Yes, we'll break down fraud, waste, and abuse for next meeting.
Thank you.
Next slide is the county care fraud, waste, and abuse recovery metrics. And this is not, if you look at the tips and the referral bucket, we're at 215 and 80, whereas last year we were at, or 2024, we were at 177 and 95. The overpayments identified, you'll see in Q1 for 2025 were 9 million. And we believe that is the last remnant of the COVID provider increased overpayments. So as you'll see, the numbers are much lower going from there. So we anticipate that this will remain. If there's no questions, we'll go to the next slide, which is payment integrity. And this is not fraud, waste, and abuse. This is data mining and clinical audits that we do on the payment integrity piece. And you will see that the last year for 2025, we collected overpayments identified 5,352,000 and overpayments collected 2,635. That's not a direct one-to-one ratio because we don't always get to collect the dollar for dollar for what we identify. New this year is we do have some NICU cases that we were not previously recorded that are now included in these numbers. And this was when we compared prior authorizations with billing records for NICU cases. On the right-hand side, proactive preventative loss. This is preventing a bill from being dropped. So we have edits in place to prevent billing. And this was a large amount of this was the COVID providers because we did put in pre-bill edits. So you'll see that the numbers are going down as we get through the COVID piece. Any questions on that? Okay. Thank you. I'll move on to the receive and file, both the annual reports for county care and the system. Okay, and then looking forward to this year, in addition, again, we'll continue to administer the 7 elements of an effective compliance program. And then this year as well, we have some key new initiatives. And one is the Accountable Care Organization Compliance Program. We have entered an ACO this year for the first time, and they have compliance program requirements that we are comparing to our existing program and noting if there's any exceptions, if we have to make any edits or corrections, and we anticipate an audit on this sometime this year. We are developing supplemental training and education programs to go with the programs that we already currently have on our learning management system. These will be shorter, more targeted programs to both for refresher training and then those that are have an issue that are brought to the fore that we'll use for correction. And one of the benefits of putting it on LMS is that we can track completion. And then we are expanding our auditing and monitoring activities, both on the county care, privacy, and system compliance side, to make sure that we are continuing to monitor. Even those things that we've fixed, we have to continue and monitor to make sure that it sticks. So we'll be doing that as well. Any questions for me, please?
Any questions? Hearing none, can I have a motion to receive and file the FY 2025 annual reports for the County Care Compliance Program and the Cook County Health Compliance Program? So moved. Is there a second?
Yes.
All those in favor say aye.
Aye.
Aye. Our next order of business is the committee meeting minutes from October the 17th, 2025. Can I have a motion to accept the minutes of the October 17th, 2025 Audit and Compliance Committee meeting? So moved. Is there a second? All in favor?
Aye.
Say aye.
Aye.
All opposed? Hearing none, the motion carries. Committee will now be going into closed session. Action is not anticipated to be taken in open session after the closed meeting has adjourned. Can I have a motion to go into a closed meeting pursuant to the following exceptions to the Illinois Open Meetings Act, 5 ILCS 120/2, parentheses C1 and 29?
So moved.
Is there a second? Motion has been made and seconded. Are there any questions on the motion? Madam Secretary, please take the roll call on the motion.
Roll call vote on the motion to go into closed session. Aye or nay? Director Kim? Aye. Director Ryder?
Aye.
And Chair Harrington?
Aye.
You have 3 yeas and 0 nays.
The ayes have it, the motion carries. We will now be going into closed session.